any informal leaders on this unit? And why do you think that they've become kind of the informal leaders? What has turnover been in the last few years on this unit? How long have you been the manager of this unit, and then are you responsible for any other units? Is there a unit nurse educator, or does the educator have many units they're responsible for? Like, how is education provided to the staff? Let's say there's a new policy change, maybe the central line dressing change policy gets updated. How are we on the unit working day to day, working night shift, notified of changes like that? What is your sister unit, and what's the relationship and dynamics like between your unit and theirs? How often do people have to float to other units? And also, how often are people floated to our unit? And not just nurses, but also healthcare techs as well. Are the healthcare techs self-led, meaning do they come in and know, hey, I've got to turn all of my patients and I've got to bathe them and do their vitals, and I will ask the nurse if I need help? Or does the healthcare tech wait until they're told that the nurse needs help? How many patients does the charge nurse have? What kind of training do preceptors get? During a shift, is there kind of like a team mentality, or is it more like everyone is kind of doing their own thing? Like, when is the charge nurse regularly checking on other nurses to see how they're doing and how they can help? And are other nurses checking on each other regularly? Or is it you do your own thing and it's up to you to speak up if you need help? Do you have like IV teams, or on this unit, how does it work with blood draws and central line draws? Is that something that is the responsibility of the nurse when the order comes through, or are there resources to support and facilitate addressing those things in a timely manner? You can craft those responses based on if it's a peer interview, if you're interviewing the manager, or if you're interviewing with a director, or if it's an HR person. If an HR person is with you and it's not someone who's regularly on the unit, they're not going to know the answers to this. This is for a peer interview or maybe a manager of that specific unit.